Welcome, everybody, to Pause, Reflect, and Heal. I'm Dr. Randy. We are here where we celebrate pet wellness and longevity, where we can help your pets live healthier, happier lives, so you can too. With me today, I'm very honored to have Dr. Gary Richter, definitely one of the founders of our integrative movement, I would say. He is a very impressive guy. We've got a lot of things to talk about, but let me give you a little bit of background about Dr. Richter. He's a graduate of the University of Florida with a BS in Animal Science, MS in Veterinary Medical Science, and a Doctor of Veterinary Medicine with honors. From 2002 to 21, he was owner of medical director of Montclair Veterinary Hospital in Oakland. He launched holistic veterinary care in 2009, also in Oakland. Dr. Richter is certified in veterinary acupuncture as well as veterinary chiropractic, and he uses therapies along with his veterinary medical education to achieve better outcomes for his patients. Dr. Richter's animal hospitals have received more than 30 local and national awards, including Best Veterinary Hospital, Best Veterinarian, Best Canine Therapy Facility, and Best Alternative Medicine Provider. Dr. Richter was named one of the top veterinarians in the United States in 2012, and America's favorite veterinarian in 2015 by the American Veterinary Medical Foundation. He has also received the Holistic Practitioner of the Year Award from the American Holistic Veterinary Medical Association. So for more information on Dr. Richter's work, as well as pet health resources, visit him at mypetthrives.com. Dr. Richter, welcome to the show.
Thank you. It's a pleasure to be here.
I always love these bios because I never know where to start or where to stop, especially with mine or yours for that matter, because there's so much going on. So congratulations with all you achieved. I'm again, very excited to be able to talk today.
Thank you so much. It's always interesting to hear somebody else read that stuff and you're like, who is he talking about? Oh, right. That's me.
Right. I love the Best Veterinarian of the Year award. I want to go after that someday, so I can have that in my moniker also. So
there you go.
So I have a question. I talk a lot about my allopathic practice. I came from University of Pennsylvania, graduated with honors there, did an internship, went to Animal Medical Center for a year, ended up in Tucson, Arizona, where I was shocked on the quality of veterinary medicine coming from those East Coast establishments. We were still kind of a cow town in those days.
Sure.
And for me, I practiced allopathically for about 10 years and met Dr. Andrew Weil, decided that I was putting out a lot of fires, but I really wasn't getting to wellness and longevity type things. And so I went to Albuquerque to learn Chinese medicine from the Southwest Institute, a human, institute. There wasn't a lot going on in veterinary medicine at that time. Sure. Only to find out that I had to learn Chinese medicine, which really was like, oh my God, a whole new paradigm, But, I think the take was, and what I'm getting at was, it was kind of like a light bulb went on for me. How did that happen for you?
Oh, that's a long story that I will condense
sure.
for the purposes of this conversation. But I had been, like you, I came out of school a very conventional Western veterinarian. I was fortunate enough to have kind of a brush with Chinese medicine in veterinary school before that was a thing in veterinary school. But just fate would have it. I had a brief exposure, but really what happened was I'd been out in practice about 4 years. I'd worked emergency, I'd worked general practice. And what I think a lot of people that don't practice medicine don't realize is that medical practice is it's a little bit like engineering in the sense of very frequently you're following an algorithm. If this, then this. If your test results show this, then you do that, then you offer this treatment, etc. And the reality is that for chronic problems, there's an end to that algorithm. There's a hard stop where there's nothing left to do. And then as a veterinarian, you're sort of faced with the reality of you have to have this conversation with somebody about there's nothing else we can do. take them home, keep them comfortable, call me when it's time. I hated having that conversation. I still hate having that conversation with people. And what happened is it led me to start thinking about, well, is there something else out there that can get me further down the road, that can extend that algorithm for me? And because of that brief brush with Chinese medicine I'd had in vet school, I wound up getting acupuncture certified. That was sort of the first step for me. And much like you, I think as a Western trained doctor, to sit in your first Chinese medicine class, it's a very disturbing and a little bit upsetting experience. I remember sitting there and the teacher started talking about how critical the spleen was to digestion. And I remember sitting there thinking to myself, man, you are going to have to let go of a lot of stuff if this is going to work. But long story short, I got acupuncture certified and started doing that. And I'm sure that this happened with you as well. So you start treating your patients with acupuncture, and like, there's the Western part of you that there's this little voice in your head that's going, this is all BS. This isn't going to work. And then suddenly your patient starts getting better. And once you see that, you can't unsee that. Like, suddenly I have a tool that I didn't have before that can make my patients better. So acupuncture led to chiropractic, led to herbal therapy, led to, opening an integrative practice. And now it's hyperbaric oxygen and ozone and regenerative medicine and longevity science and everything that comes with it. And really, it kind of led me down this pathway to, my mission as a veterinarian at this point is the search for any sort of legitimate modality that I can use to help my patients. If it's got some sort of legitimate scientific foundation to it, I will investigate it and find out whether or not it will work for my patients. It's not about, I think a lot of people hear holistic medicine and they think of people like burning sage and waving crystals and whatnot. This is science. It's just science that's a little bit off the reservation from the perspective of Western medicine. But we're able to do things in our patients that Western doctors just aren't able to do. And it is just the most rewarding thing you can possibly imagine as a doctor, to be able to get that kind of work done.
Yes. No, and I think that's a really good point. And I love the transition for you because it was so similar to me, and the shock and awe value of the first IVIS course, and listening to someone like Dr. Shea speaking, who I could barely understand, and realizing that, this was a lot that I was biting off. But, I think the thing that's so interesting is that you alluded to, and I'm glad that you did, was that I think it's the same for both of us, really, that we really look for things that we can utilize in our practice that really have some science basis. Sure. And, I get a lot of people, and it was, you fought this battle. I fought this battle now for over 30 some years, that, there's no double blind study for that. So how do you really know what's going on? Sure. And it's, I had this conversation with Andrew Weil, and, here's an MD that started, this integrative department at the University of Arizona Medical School, and he was a charlatan. I mean, people thought, oh my God, this guy is like, where is he getting this stuff from? And so it's exciting to see the progression. I only wish our veterinary schools were a little bit more open, and they're getting there, but they're still not at that place where I've spoken to University of Arizona students, to Oregon State students, to Washington State students in their holistic club, and then get fringes of people coming to listen to the talk. And it's really fun because we see some of these very allopathic Western guys who are doing research buying in. And so that part has been really exciting for me. So I think one of the things that you also talked about that I like our listeners to understand is there really wasn't one place that this all happened. You had to pick and choose, find these things and really go after them, just like I did. And I get that from vet students and new associates all the time. Like, well, where did you learn all this? And I'm hoping that it's going to become more of a mainstream thing for us to be able to pass on.
Yeah, I agree. And I mean, people ask me like, well, why don't they teach this kind of stuff in veterinary school? And my comment to them is like, look, like that 4 years in vet school is jam packed with information. You know, you're not sitting around by the pool,
Right.
you know, so there's only so much that they can teach you in 4 years. And I think writ large, they do a very good job.
Right.
I wish that they would at least introduce the concept of there being sort of other modalities that like, oh, hey, there's this, you could go learn about this at some point. I wish they would do that. But
Sure.
beyond that, I mean, you know, there's only so much they can do in that scope of 4 years. And at that point, yeah, I mean, it really is up to you as a practitioner to kind of pursue that education. And you know, the things that I always tell new doctors or people that are pre-med or pre-vet is, if this is your career path, the one thing you have to be above all else is a lifelong learner. You have to be somebody that always wants to learn more. You know, there's the old joke about, you know, there's a reason why they call it medical practice, because nobody ever gets it right. You know, like there's always something else to learn. And that's one of the things I love about holistic and integrative medicine is there's always something else to discover. There's something new. And you know, I mean, I have veterinarians ask me all the time, well, you know, like what holistic modality should I learn first? And my response to them is wherever your interest lies,
Yes.
whatever excites you. It doesn't have to be acupuncture or herbs or chiropractic or whatever. It's whatever motivates you and resonates in your heart. You're like, yeah, that's the thing I want to learn. Go do that.
Absolutely, and that's the best advice ever. You know, I've been looking for a young associate who really has some interest in integrative medicine for my practice. I'm 71.
You and me both, brother.
Yeah, I know, and I'm hoping one of these days that the universe is going to be happy for both of us and supply somebody like that. But you know, I know it will happen, and I'm down to like 3 days a week now seeing clients and speaking and doing other things besides. But
Yeah.
I love the fact that you also mentioned that it's a lifelong process because, you know, people say to me, well, they come into my practice, I have clients, you know, for 25 years, let's say, and they go, well, like, oh, I heard you're going to retire. And I go, you know, I'm going to retire when the universe says it's time for me to go. And that's going to be hopefully a sudden situation, and I just won't be here. But right now, I'm so excited about everything, keeping my hands in things. And like you said, learning every day because it is a total learning process. So it's been a lot of fun, and I can't complain. And I think the ride for both of us has probably been very similar in that respect.
Oh, I have no doubt.
Yeah. I thought about, I want to talk a lot about some of the things that you've done specifically, but a little thought about longevity and wellness in pets. You know, you've addressed this in 2 of your books. Your ultimate book is also fabulous. I have a copy on my desk. It often gets shown to my clients, which is nice.
Thank you.
You wrote a lot of what I would like to put in print, but I'm not a real verbal written guy. So thank you for doing that because it's a great reference to turn to.
Oh, wonderful. I'm glad you like it. Thank you.
Yeah. So just a little thought about what where you are now with longevity and wellness, and maybe, you know, your thoughts about where that's going with our pets these days.
Sure. You know, I mean, if it's a word that resonates with you, it's the kind of thing that you're starting to see pop up in the media an awful lot now.
Yes.
Longevity and various sort of, you know, longevity science or medical interventions or whatnot. Because it is a very, very robust field of study on the human side right now. And there's a lot of reasons for that, but the bottom line is that for the first time in history, scientifically speaking, we actually are starting to get a handle on the cellular and biological processes that happen in our body that cause us to age. Prior to that, it was just like, oh, well, you know, the body gets old, it shuts down, you die. And on some level, that's true. But there are things that happen along the way. And now we're starting to understand what those steps are, which means that once you understand what the steps are, then you can start to talk about how to intervene in those steps. And obviously, we're going to talk about this quite a bit today. But but to me, the interesting thing from a veterinary perspective is I got involved in longevity because a very good friend of mine actually started a longevity conference for humans, and he invited me to join. And the reason why I joined, I mean, in part because obviously I'm interested in my own health and longevity, but a big piece of it was the question of, are there going to be things that are available out there that I can adapt for my patients, in my office for largely dogs and cats? And what I learned is almost everything that is being done on the human side in longevity science is based on either preclinical or animal studies. There's no double-blinded, placebo-controlled clinical trials in humans on this stuff, and yet humans are using it all the time. Well, if humans are going to go that way, then clearly it makes sense for us to kind of investigate this stuff for animals. It's very early in the process. Longevity science is a very, very young field. But I do believe that what we're seeing, even preliminarily, has been incredibly encouraging from the standpoint of improving quality of life of these animals. I don't think we've been doing this long enough to be able to say we're dramatically extending lives of animals just yet. I don't have a canine patient in my office that's 35 years old. I hope at some point I will. We just haven't been doing it long enough to know.
Perfect. Yeah, and I absolutely agree with you. And I think it's interesting because, as you mentioned for yourself, much of the information that I incorporate in my integrative work, a lot of it had to do with me. I mean, I have numerous mountain bike accidents and played basketball and blew my knee apart, and all of the things that I could do for, even looking at biohacking. I know you've talked to Dave Asprey, and you look
Sure.
at guys like Peter Attia, and, some of these people are really doing some amazing work. But, I got to meet Matt Coberlane from the Dog Aging Project and
Yep.
spoke to him quite a bit. And it's so exciting to see, well, first of all, that they've identified that our pets aren't living the life they should be living, that they're not really fulfilling that genetic predisposition, let's say, and we're affecting that through epigenetics and nutrigenomics, and those are fancy words that I've talked about in the past with my listeners. But it's exciting to see that they're making some steps, and I agree with you that a lot of it has come from my own work, and I like to say that I'm the test tube for a lot of my patients because I look at some of these things to say, if it really does make a big difference in me, hopefully it's going to make a great difference in my pets because, as you said, there's a lot of similarity in that situation, obviously.
Oh, for sure. I mean, obviously, there are differences between human medicine and veterinary medicine, but, speaking big picture wise, mammals are mammals in the sense of like, we all basically work the same. So yeah, you have to approach this thing with a critical eye and make sure that you're, above all, do no harm. But that said, from what I have seen, almost everything that is being looked at on the longevity side for humans is applicable in animals. I wouldn't necessarily put my dog in an infrared sauna, but
Right.
you use common sense for these things. But outside
Right.
of that, it all works.
Right. I just had the fortunate ability to speak to Dr. Wiles Fellows through his integrative program, a webinar that I like doing in-person talks a lot more than I like webinars, but it was really interesting. They invited me to their integrative summit this year, which is 1,500 MDs, DOs, naturopaths, and
Oh
one
wow,
veterinarian.
that should be fun.
It was great. I was there actually.
Oh, okay.
And I was the one veterinarian, and I learned some really interesting things that
Yeah.
I'll pass on. We can talk about. But so I utilize in my talks a mnemonic. Everybody makes up a mnemonic. Mine is PETS, which is proper nutrition and microbiome, exercise, training and socialization, and stress reduction. And a lot of it you mentioned in your book, and a lot of things that we do. It's really fun. I'm kind of branching off to talk a little bit about the nutrition thing because you've really looked at this and you have a wonderful freeze-dried product that we recommend to our clients a lot. Talk a little bit about how that education came to you because that's, again, another whole area in veterinary medicine that's tough. if you look at the standard nutritional recommendations, they're not going to fit the bill for you and I.
No, I agree with you. And, you know, I mean, I think if there's one area where our profession really drops the ball, it's nutrition. And, you know, that is largely in part to we get almost no nutrition education in vet school. And, you know, I am definitively not a conspiracy theorist in any way, shape, or form. That said, you can't get around the fact that most nutrition research done in the veterinary space and most continuing education done in the veterinary space regarding nutrition is in one way or the other paid for by big pet food.
Yes.
It just is.
Absolutely. Yeah.
And obviously these folks have a perspective. They have a motive beyond purely educating. So unfortunately, most veterinarians' scope of information comes from that place. And, you know, the thing that I always remind people when they start going down that whole conspiracy theory avenue is, look, almost every veterinarian I have ever met practices from the heart. We all want our patients to be better. There's nothing sinister going on here on your veterinarian's part. They're working with the information set that they've been given. And what they've been given is, you know, put your dog or your cat on a kibble, on a dry food diet, until such a time they get to a point in their life where they need a prescription diet. And you know, here's the thing. You don't need a PhD in nutrition to understand that eating a diet that is solely consists of highly processed food is probably not ideal. We all know that the more fresh whole food that we eat, the more healthy we're likely to be. And the less processed food we eat, the healthier we're likely to be. Why anybody thinks that's different for a dog or a cat is perhaps one of the most unanswerable questions I could come up with in veterinary medicine. You know, but the bottom line is I look at all animals as a biological machine, which is effectively what we are. All biological machines have evolved to thrive on a certain level and a certain type of nutrients. You know, so, you know, it's optimal nutrition for a dog versus a cat versus a person is a little bit different, but we're all sort of biologically designed to thrive on a certain spectrum of nutrients. Those spectrum of nutrients come from fresh whole food diets. There's all kinds of problems, and I'm not telling you anything you don't know, that there's all kinds of problems that come with these processed foods, be it nutrient loss or the addition of chemical compounds that happen during the processing that are pro-inflammatory, are known to cause cancer. All sorts of problems arise from these things. And now we as a profession are telling people this is what you should feed your pet. And then everybody scratches their head when they get arthritis and cancer and die young. You know, I mean, if you just take a step back and look at the big picture, it's pretty clear. You know, that and as I'm sure you've seen in my books, Longevity for Dogs and Longevity for Cats, the very first thing that I discuss in both of those books is nutrition. Because the bottom line is, it is the single most impactful thing that anybody can do for their health or their pet's health. And it's one of those things that nobody needs to come to you or me to talk about. Right. You know, like, you don't have to pay me in my office to figure out how to feed your dog properly. All that information is out there. So it's just a function of feeding your pet a properly balanced, fresh whole food diet. I mean, you know, I don't know if I've completely answered your question. I mean, for me, you know, that sort of educational line just happened over time. As you learn more and more about holistic and natural medicine, you start to realize, like, oh yeah, you know, that whole thing about you are what you eat. Guess what? That's true.
Yeah.
And we really just need to get back to that. And many of the problems we're seeing with pets would improve.
Yeah. And I love this because you had mentioned, you know, not needing a PhD to understand this. I always, on any of my cases these days, so I do integrative medicine, but I also do rehab medicine. We we have a great rehab facility at our practice. And I'm shocked when clients come to me and we sit down and I try to explain to them that we're going to start on some foundational medicine before we talk about your dog's arthritic problem.
Yeah.
And they look at me in surprise because they don't understand why we're having the food conversation until I produce the label from their dog food bag on their prescription diet that they're feeding and say, we're trying to get the inflammation out of your dog's body or your cat's body. And we need to do that by fresh whole foods. And here's the food pyramid. Here are our choices. And then it starts to make a lot of sense. First time in 10 years, Gary, I have to tell you this. First time that I've been having that conversation, I had somebody write a review of me saying that I lectured them on pet food and I never talked about the issue for their animal, which, just it got to me, because I'm thinking to myself, first of all, it's not a lecture whatsoever. It's just trying to provide the information. At which time I provide the information for your book and from Karen Becker's book. And so it said, please read. If you want the science behind all this, I don't have that time. But most of the time we start there, just like you said, and it's been a godsend to be able to have some backing information to talk about that. And then actually seeing the differences as we make that transition out of simple carbs and processed food and alleviating that whole situation. And the other thing that I'll mention too, because you mentioned it, is, clients come to me and say, well, how come my veterinarian didn't talk about this? Why am I on this prescription diet, or that prescription diet? I said, because as you mentioned, everybody's practicing for the love of these animals. No one is trying to be malicious, but it's the information that's provided and how deep you look to decide where you are as a professional to make your recommendations. And when you're only provided this bit of information through lectures and seminars in vet school and post, that's what we use. And I understand that. I'm not saying it's a path that I chose or that Dr. Richter has chosen, but it is what is done. So fortunately, we can get the information out. And like you also mentioned, there's so much information right now for our pet parent that they can get this without you and me. I'm just wanting to support it, and I know you are, and I think the more we talk about it, still maybe the more ears it gets to.
Yeah, no, I couldn't agree more. And medicine is a great, it's a great example of this, in the sense of, you look back on sort of what standard of practice in medicine was, say, 50 years ago. And we can look at some stuff that used to be done that you look at it now, you're like, oh my God, I can't believe that was actually shit that we did. and you know what? I mean, it's only because we know better now. Like, nobody was trying to do anybody any harm. That's just what we thought was the right thing to do.
Yes, absolutely. Absolutely. So, one of the things that that mnemonic, proper nutrition, there's also microbiome in there. Yeah. And I also use a lot of, in fact, I just got off the phone yesterday with Gene Dodds in British Columbia. I use a lot of Nutriscan testing for food sensitivity, and then I couple it with animal biome. And it's been a godsend for things like allergy and GI disease for me, and even arthritis. And so, I love the fact, like you said, that we have other modalities to use nowadays to really achieve great benefit. And so the microbiome piece for me has been amazing, but I wanted to tell you a quick sidebar because you'll love this. So at this integrative seminar, being the one veterinarian, I attended a lecture from the head of GI pediatric gastroenterology from Stanford. She's a lovely lady, very bright, very, very brilliant. And her whole talk, her whole talk was on small bowel overgrowth and Clostridium and these kinds of things that are causing huge problems in humans. And there was only a sidebar mention of microbiome, like the slightest bit. And so I raised my hand towards the end of the seminar, and I explained that I was an integrative veterinarian, and I had a question about why they weren't incorporating more microbiome work in their work themselves. And she said, well, Stanford has a whole microbiome section. We've got a guy. That's all he does.
We got a guy.
But we can't effectively use some of these things yet because we're still afraid of what the complications are for FMT or fecal microbiome transfer. I mean, we're using it for severe C. diff or C. perf cases, let's say. We're using it for SIBO occasionally, but that's where it stops. And then I explained to her that our companies, the people that we can use, whether it's Margot Roman or Animal Biome, or have freeze-dried supplements that we can now use along with FMT. And she said, the first freeze-dried capsules just came out for human use. The cost is $17,500 for one.
Oh, for the love of God!
And I go, you got to be kidding me. She said,
I thought Margot charged a lot.
Yeah, exactly. So the good news for me and you is we're way ahead of them on this stuff. I mean, as far as incorporated in a day-to-day use.
Yeah, I couldn't agree more. And that's like, one of the great things about veterinary medicine is you have a degree of freedom that our colleagues on the human side will never have. So we're able to do stuff that they can't do.
Right. Do me a favor, talk a little bit about the books, because I'd love our clients to be looking at these, to reading these. I mean, I suggest it on a regular basis, but talk a little bit about all three, if you don't mind.
I appreciate that. Thank you. So
sure.
The first book I wrote it's called it's called The Ultimate Pet Health Guide. And that book actually, it started out as a book about nutrition. And then it kind of got away from me. I just sort of kept going.
Right.
And the publisher was like, "Are you done yet?" I'm like, "No, I'm not." But they were patient with me. What it turned out to be was, a discussion about nutrition, sort of a very expanded discussion related to the one we just had. And then it turned into a discussion about a long list of medical conditions. So heart disease, kidney disease, diabetes, allergies, arthritis, the list goes on and on. And where I was coming from is I sat there and I thought, okay, what are the things that I see in my office all the time? And what is the conversation that I would have, or if I had more time, really like to have with clients about this particular problem? Because one of the things I find in my office, and you, Randy, you probably see this as well, is one of the reasons that people come to me with pets that have been diagnosed with some condition or another is because their regular veterinarian who made the diagnosis did not have the time to sit down and explain to them what this means. Somebody comes in and they say, my cat was diagnosed with kidney failure. They have no idea what that actually means. So this was my opportunity in text form to really write down. So the way I approached it is I said, okay, so here's a diagnosis. This is the disease. This is what it means. This is how it's diagnosed. This is how it would be treated from a Western medical perspective. This is how you would treat it from a holistic perspective. And then finally, this is how you would treat it as an integrative case. This is how you would sort of combine Western and alternative medicine to get the best results. And I went through that with, 15 or more different big picture medical conditions, and then went on to discuss things like, proper vaccination protocols, how to pick a veterinarian that you see eye to eye with. There's 25 different fresh food recipes for dogs, 25 for cats. So it was really sort of like, it was kind of just a brain dump, if you will, of like, here's just about everything that I could think of that I would have a conversation with a client in the office. So, I mean, the way that I explain that book to people is it's not necessarily designed for you to read it cover to cover. You certainly might want to read the nutrition part, but the rest of it, it's more of a reference from the perspective of, okay, my dog or my cat has arthritis. Let me turn to that section and kind of read through and see what's appropriate for my pet. So that's the Ultimate Pet Health Guide, and I've been so pleased with the reception of that. A lot of the motivation behind writing this is, you start to think about how many people are out there who don't have access to come into my office or your office or somebody else's office that does the kind of things that we do. Because, I mean, unfortunately, there's not that many of us out there.
Right.
So not everybody has that kind of access. So, here was a way for me to kind of share that information to people who maybe didn't have that sort of access. And then some years later, as I mentioned, I really started becoming involved in the whole longevity medicine and longevity science area. And to me, that became a really fascinating topic to look at from a canine and feline perspective. So that became the next two books, Longevity for Dogs and Longevity for Cats. And with an understanding that most people are probably not super familiar with the nuts and bolts of longevity science, I kind of started with that. I try not to get into too much granular scientific detail and lose people, but it is important that people understand the basics of where this is coming from.
Sure.
So, what we have at this point that are published are what are called the hallmarks of longevity. So these are the various processes that happen in your body that ultimately lead to aging. Things like mitochondrial degradation, cellular senescence, stem cell exhaustion, telomere attrition, et cetera, et cetera. And so I went through and kind of explained in broad terms what all of those things mean. And then the whole rest of the book is really based on here's things that you can do that will have positive effects on all of these various aspects of longevity. So it starts with diet, exercise, and nutrition. The three most important things that, again, nobody needs you or me to make this happen.
Right.
So really explaining to people, here's how best to feed your pet. Here's how to talk about sort of what is an appropriate and healthy amount of exercise for your pet. Here's how important lifestyle is. I think people don't understand the degree of stress and anxiety that a lot of animals live with because their proclivities don't necessarily mesh well with those of their owners.
Right.
Needless to say, many people live a very high stress life. And if you think that that's not affecting you physiologically, you have another thing coming.
Exactly.
But the reality is it's also affecting your pet's physiology. And we need to sort of think about it in those terms. And then we kind of move into things like, what does appropriate veterinary care look like? And I'm sure that this is a conversation that you have with people all the time. But talking about things like, when is an appropriate time to spay and neuter an animal? What vaccines are really, really necessary? Probably after nutrition, the second place our profession drops the ball is vaccines.
Yeah.
I'm very quick to tell people that I am absolutely not anti-vax.
Right.
I am anti-over-vax.
Absolutely.
And the vast majority of pets out there are dramatically over-vaccinated to their detriment.
Absolutely.
So, talking about, appropriate veterinary, vaccine protocols, talking about things like antibiotic usage, generally overused in medicine writ large. Things like flea, tick, and heartworm preventative. All of those products have their place and have very definitive uses. But you know what? Depending on where you live, you might not need to use those products year round. Yeah. And many veterinarians, it's just easier just to tell everybody, give the Heart Guard, give the NexGard or Bravecto or whatever year round, and we're done.
Sure.
But medicine has to be individualized in order for it to really be effective. Yeah. Then we move into supplements. There's a very, very long list of supplements in the book, and specifically talking about how each supplement interacts with these various hallmarks of longevity. And then it's pharma and medical treatment and regenerative medicine. I have a whole chapter in there about wearable biometric monitors for pets, which are really not quite there yet, but they're coming soon. I'm actually developing one myself.
Neat.
That is, and to me, wearables for pets are going to be the big game changer. The biggest challenge in veterinary medicine is we've got an entire population of pets that, number one, aren't going to tell you when something's wrong with them. And number two, they're going to go out of their way to lie to you about it when there is something wrong with them.
Right.
Animals in the wild that are sick or injured and look sick or injured are getting eaten.
Yeah.
And our dogs and cats are still hardwired to make everything look like it's fine, even when it's not.
Yep.
And as such, by the time your dog or your cat looks sick, they've probably been sick for a while. And much like nutrition, you don't need a degree in medicine to understand that a late stage diagnosis does not lend itself to good treatment options and outcomes.
Right.
So anything that we can do to give ourselves that early warning system of, hey, your dog's respiration rate has been 15% above normal for the past 5 days. Nobody's going to notice that.
Right.
I'm not going to notice that.
Right.
But that could be an indication that they have a heart problem, a lung problem, maybe they're in pain. You can't say exactly what it is, except to say that something's not right.
Right.
And that's the time when you need to intervene. If it's you or me, like if I'm like, wow, like I've just had this nagging headache for the last week and a half, I should probably go check that out. Anybody know if their dog or their cat has a nagging headache?
Right. Right.
We don't know these things.
Right.
So like I say, I think wearables are really the next big future step in veterinary medicine. So you can see sort of the process I've taken with this, going everywhere from here's stuff that you can very easily do at home to support your pet's longevity. Here's stuff you can work with your veterinarian about. And here's stuff that's coming right around the corner that you should keep an eye out for. Because really what all of this is about is helping people be in the driver's seat so that you're the person in control of your pet's health and longevity, not me, not you. I'm here to help. I'm here to be an assist when it comes to medical stuff. But at the end of the day, everybody has to be their own medical advocate, and you also have to be your pet's medical advocate.
And I want to comment, thank you for the review on all three of those, because I think that really helps our listeners. And I also want to encourage them, go get these books, because they are what I recommend on a daily basis. And Gary's done a phenomenal job. I have to tell you a funny story about Ultimate Pet Health Guide.
Sure.
I have two sets of kids. I have an older set from my first marriage, and my youngest of my older is 36, and she lives in Fort Worth. She's a nurse anesthetist.
Okay.
And my wife had a Volvo hybrid. She wasn't really happy with it. My daughter wanted it in Texas, so I decided to surprise her and bring her the car. The reason I'm telling you the story is because I'm listening to your book on Audible on the way over there to hear. And I love the fact that you really mentioned kind of right off that this isn't a cover book read if you don't want it to be. It's a great reference. And it is a great reference because every single one of those areas, let's say I've got a heart dog and it's BNP, which is, for guys who are listening, for people who are listening, this is an enzyme that sometimes we can look at heart stretching and if the heart is working overload as far as what's going on. And in the past, 5 years, I've been using ubiquinol as a supplement and watching these BNP levels come down and actually these dogs feeling better. So the fact that you can go to Gary's section on heart disease and find out information on specific amino acids that might work or other things that we can do, it's a phenomenal thing. And then talking about the longevity books, it really does help to hear all of the things that are available. And the nice thing for Gary and I will mention is that we can take the time with our clients and explain a lot of these things. We have been doing vaccination titers in our practice since it began 15 years ago.
Sure.
And, clients say, well, why would I spend that extra money on a DAP titer through, Kansas State when I can just give the vaccine? And I go, well, because, I want you to understand this is an immunological load that we're putting on top of your dog or let's say DRC or cat. And if it doesn't need it, as Dr. Richter mentioned, then why do that? Why would we want to vaccinate this animal when we could specifically get titers? And the other point that I wanted to make about that was rabies. Now, we have rabies in Arizona, and it's an issue. I mean, there are definitely areas that we have rabies, and it's definitely still an issue. One of the things that's interesting is that our county won't let our dogs be licensed unless they have a vaccine.
Right.
They will not accept titers.
Yeah, mine as well.
Most of the boarding places and the grooming places now we've educated, they'll accept titers and they're perfectly fine with them. Because the conversation is, if you're going to Hawaii or England we are rabies-free areas, you have to have a titer. It doesn't matter how many vaccines you've given the animal. If your titer's not protective, they ain't letting you in.
Yeah, it's a crazy thing, right?
So anyway, we have a lot of clients that elect not to license and then do titers, and because they feel much better about it, and we can eliminate, the over vaccination when it comes to rabies also. Sure. So I love the fact that you've mentioned all these things, and thank you for that, and thank you for the work, because it really is very helpful for the rest of us in the trenches that are doing this to have some text behind us, to say the least.
Well, I appreciate you saying that. Thank you.
Yeah, absolutely. I want to talk a little bit about just some specific kind of diseases or syndromes that we look at. And I'll tell you, the difference for Dr. Richter and I is we don't always look at dis-ease. We're looking at the whole body. And many times these are syndromes that are different. I think one of the things that always hit me when I took the IVUS course was, we can go in with burning pain in our stomach. Our doctor tells us we have a gastric ulcer. Here's the medication you're going to use, and we're out the door. We could have those same symptomatologies in our dogs and cats and have 5 different Chinese syndromes that could be producing them, and going in a completely different direction for people, as you said, spleen overacting on stomach or whatever the situation is. And so it's very fascinating to hear about some of these specifics. But could you kind of talk a little bit about, maybe just the daily things that you see, as you mentioned, GI disease or arthritis, or a little bit about allergy, some of those things, if you don't mind?
No, not at all. I mean,
we don't have to get into a big conversation because we don't have a lot of time, obviously, but whatever you think mentioning about those.
Yeah, so I mean, I guess probably one of the most common things that many veterinarians see are arthritic animals. And like you, I mean, we do a lot of rehab in my office. So, I mean, we see a lot of geriatric arthritic patients, a lot of post-op orthopedic surgeries and whatnot. So we're dealing with a lot of inflammatory related pain. And, and needless to say, there is a place for pharmaceuticals, for non-steroidal anti-inflammatories, and we do use them. But I also look a lot towards natural anti-inflammatories, compounds like boswellia, curcumin, things like devil's claw. There's any number of herbs out there that can be beneficial. Hyaluronic acid can be very beneficial. Type 2 collagen, I think, is an amazing supplement that is underused. What we use, and I'm sure you do this as well, but like probably the one sort of arthritis related thing in my office that we have a real hard time keeping on the shelf is Adequan.
Yeah. Oh my God. Yeah.
I think to me, Adequan is probably the most underutilized pharmaceutical in veterinary medicine.
I agree. Agree.
For people who don't know, I'm sure you're familiar with glucosamine. Adequan is basically the same source material as glucosamine, but it is purified to the point where it can be given injectably. It works way better than orally administered glucosamine. It is incredibly easy to give. It works great, and it doesn't have all of the back-end side effects of the non-steroidal anti-inflammatory drugs. So to me, for an arthritic animal, I feel like Adequan is the first pharmaceutical you should reach for. And unfortunately, in most veterinary settings, it's the absolute last, if ever at all.
I agree.
Which is fascinating to me, and I can only assume that there's some sort of like mental block because it's given injectably, so it's not easy. Yeah. But of course that theory has gone out the window with Librela, because that's given injectably. But
right.
Nonetheless. So, and then, kind of just, related to this whole osteoarthritic question, there's also, you got to come back to diet, nutrition. Is what they're eating promoting inflammation? If they're eating dry food, the answer is yes. Yes. So then it's a question of, can we get them on an anti-inflammatory diet? Can we get them on the right supplements? And, to me, reaching for the NSAIDs, reaching for the carprofen, the meloxicam, what have you, that's a thing that you do after you've already done the diet, the boswellia, the curcumin, the Adequan.
Yeah.
And if they're still having pain, then sure, you use that. It's
Sure.
fine.
Sure.
It's just not the first thing that you reach for.
Right.
And looking at, from another condition, the other thing that, of course, everybody sees all the time is allergies, skin
Sure.
problems, that sort
Sure.
of thing. To me, I mean, so much of that comes back to nutrition.
Yes. Yes.
I can't tell you, well, you already know, but like how many people you have come in with animals that have chronic allergies. Their regular veterinarian has tried everything under the sun, including prednisone, Topica, what have you. And then you switch them to a fresh whole food diet and they get better.
Yep.
Clearly, it's not every time, but it is unbelievable what a big difference it can make just getting these guys on a fresh food diet. That can make a huge difference. The other thing that we're doing a lot of in the sense of, I guess, both arthritis and allergies is we're looking at omega fatty acid levels in our patients.
Yeah.
It's amazing to me how many pets, even the ones that I think are eating good diets, are low in omega-3s.
Yes.
Omega-3s are great for their skin. They're great for gut health. They're natural anti-inflammatories. And most pets walking around are deficient.
Absolutely.
So supplement the omega-3s.
Yeah.
You can check things like vitamin D levels. Supplement the vitamin D. I love a good diagnostic test because anything that I can quantify, then that gives me something that I can move towards fixing.
Which is what I want to mention is we mentioned to a lot of clients is we're still using Western medicine in this effect because we're looking at these things. Quick question on the omega-3s. Who are you using as far as your testing for that?
We're using omega-3 Quant.
Okay.
Yeah. You?
Because I did my own, and I couldn't believe how low I was, and yet I seemed to chug down a lot of omega-3s during the course of a day. So you're absolutely right. It's I haven't gotten to doing a lot of testing, so that's why I asked. I do VDI for vitamin D and B12 and
as
and
do
some
we.
of the
Yes.
yeah. So, but you're right. We can quantitate all that, which is really fabulous.
Yeah, and for if it makes you feel any better, I was also dramatically deficient in omega-3s. And the amount of omega-3s that I have to supplement in a day to keep my levels where they should be is a little bit shocking.
Yeah, exactly.
It's
amazing.
a lot.
We don't walk around smelling like fish all day.
It's a lot, yeah.
So we have just a few more minutes, and I want to thank you. I mean, I think we could have probably done this for 4 hours, but I won't keep you, and I know you got a busy schedule. Maybe we could talk about a take-home message for our listeners. We can wrap this up and talk a little bit about both of what we've done. And my invitation is I hope you'll come to Tucson sometime and visit.
I'd love to.
I'd love to meet you in person because we haven't done that. Maybe we can see you at a meeting or something like that. But maybe talk a little bit about take-home message for our listeners.
Sure. And I think we've talked about this in sort of various ways or whatnot, but I mean, I think the things that I would like to leave people with are, number one, realize that your pets are 100% dependent on you to take care of them. And some of the things that you can do that will have the greatest impact in many ways are the easiest things you can do. Diet, exercise, lifestyle. The three most impactful things you can do. You don't need a veterinarian. You don't need any special training to move towards this. You can find that information in my books. You can find it in all kinds of places. I'm certainly not the sole arbiter of this kind of information. It is out there. The next thing I would say is find a veterinarian that you resonate with. Like if your veterinarian's making recommendations that don't feel right to you, I never have a problem with suggesting that people ask questions of their veterinarian. Please do it respectfully.
Yes.
But ask questions. If you're wondering, do they really need this vaccine? Do they really need the flea and tick control? Do they really need the antibiotics? Then ask. If you don't like the answer that you're getting, or you feel like you're getting stonewalled in the answer, maybe you need to find a new healthcare provider for your pet.
Yeah.
Again, At the end of the day, you are your pet's medical advocate, and if something doesn't feel right, then explore other options. And the other two things I would say is, number one, in the sense of being your pet's medical advocate, the internet is the greatest and the worst resource of information in the world out there. On the good side, the internet has democratized medicine. No longer is medicine solely in the possession of medical professionals. It's all available to you right now. I think most people these days have learned how to be a fairly discerning sort of internet researcher. Go online, do a little research. If something sounds like it's too good to be true, you know that it is. But there's a lot of information out there that you can learn that you can then ask your veterinarian about if you're not sure. Again, please do it respectfully, but ask the questions. And then the last thing that I would say in that same vein is educate yourself, whether it's my books that they're available on Amazon. You can get them in print, you can get e-copies, you can get Audible versions. I mean, like whatever it may be. There's plenty of other really good books out there as well, as far as natural and holistic pet care. So be that person that strives not only for your pet's health, but for your own. I think if you read the Longevity for Dogs and Cats books, you're actually going to learn an awful lot about how to take better care of yourself.
Absolutely.
Because all of that science carries both ways.
Absolutely.
The one thing that we do know about people who own pets, they live longer. Research bears this out.
That's
you will
correct.
live longer if you have pets. So it's a very symbiotic relationship between us. Enjoy it. I mean, this is what life is about, being able to go out and have fun and care for things and be cared for by things. So this is a great opportunity for us.
Yeah. Thanks, Gary. I really appreciate it. Tell our listeners where they can find your information, website, whatever might be helpful would be great.
Sure. Yeah. If you happen to be in the Bay Area and you're interested in coming to my office, holisticvetcare.com. I have a line of freeze-dried raw foods as well as supplements for dogs and cats, ultimatepetnutrition.com. My Instagram is at petvetexpert. And then lastly, like I said, I mean, you can find the books online on Amazon. And one last thing, if we talked a little bit about wearables, if you're interested, the name of the company that I'm developing, it's called Pet Metrics. There is a website, petmetrics.com. It's a little preliminary right now, but there is a place on there that you can sign up to get on the list. As more information comes out, we'll be able to send it to you and let you know what's going on.
Perfect. And I want to offer, if I can help in any way, if you're looking at, research situations or anything that might help you, I'm really looking forward to having that, because I think
I'll take you up on that.
That's going to be a great advantage to us in practice for sure.
I would definitely take you up on that.
And as Dr. Richter mentioned, our pets are great at hiding their problems, especially, if you think about cats with osteoarthritis. So Gary, thank you so much for your time. I can't tell you, I learned a lot. I'm happy to have this time together. I hope we can continue our conversation down the road. If there's anything I can do to help on your end, please let me know.
I appreciate it so much, and thanks for having me.
Absolutely. Have a great rest of your day.
Take it easy.
Okay. Bye-bye now.